You remember the first time it happened. You were reading something, a menu, a pill bottle, a road sign, and the letters just wouldn't cooperate. You held it further away, then closer. Then you handed it to someone else. Maybe it was the evening drives, oncoming headlights starting to bloom and scatter like you're looking through frosted glass. You told yourself it was tiredness. You told yourself everyone's eyes get a little worse. But what if it wasn't age? What if it was a nutritional gap arriving on a schedule you never knew existed? Here's what nobody tells you. Your eyes don't rest when you close them at night, they work. Your retina contains over 120 million rod cells that rebuild a critical molecule called rhodopsin, your night vision protein, every single night using nutritional raw materials from what you ate that evening. A 2021 review in Nutrients found this repair is most active in the first 3 hours after darkness. If the right compounds aren't in your bloodstream during that window, the rebuilding is incomplete. Night after night, year after year, that's not aging. That's a gap you can actually fix. My name is Dr. Alex Carter. For over 2 decades, I've worked with adults over 60 on nutrition and sensory health. Today, I'm giving you 7 fruits, ranked, that support nighttime eye repair. Stay for number 1. The research behind it goes back 60 years to military aviation. The Rosette's Papaya rebuilds your retinal lining. Papaya is loaded with beta-cryptoxanthin, a carotenoid your body converts directly into retinol, the molecule photoreceptors use to rebuild. A 2020 study in the British Journal of Nutrition found it absorbs nearly twice as fast as beta-carotene from carrots and reaches retinal tissue within 3 hours of eating. How to eat it. Half a medium papaya 2 hours before bed. The deeper the orange-red color, the higher the concentration. Pair with a few walnuts or a teaspoon of coconut oil. Fat is required for absorption. Don't throw away the seeds. They contain an anti-inflammatory enzyme. Rinse a few and chew them. 6. Red grapes. Protects your optic nerve. Red grapes contain resveratrol, a polyphenol that protects retinal ganglion cells, the neurons forming your optic nerve. A 2023 study in investigative ophthalmology and visual science found it reduced retinal oxidative stress markers by 34% over 12 weeks. How to eat it. 12-15 red or black grapes in the evening. Never green, never juice. The skin holds 90% of the resveratrol. Pro tip, freeze them. Thawing ruptures the cell walls and releases more of the compound. Rhodopsin, Kiwi, supports eye pressure and drainage. 1 kiwi has more vitamin C per gram than an orange, plus lutein, zeaxanthin, and folate that work together to support the eye's drainage structure. A 2016 study in Nutrients found adults eating 2 kiwi daily had a 36% lower rate of macular degeneration progression over 5 years. How to eat it. 2 kiwi in the evening, at least 90 minutes before bed. Eat with the skin if you can. It has triple the flavonoids. If green kiwi tingles your mouth, try gold kiwi. More vitamin C, less allergenic. Before, Tart cherries fights nighttime inflammation plus improves sleep. During REM sleep, your eyes move dozens of times per minute. In adults over 60, chronic inflammation creates a damaging biochemical environment during that movement. Tart cherries, specifically Montmorency, have the highest natural melatonin concentration of any fruit, plus anthocyanins that suppress inflammatory cytokines. A 2014 study in the European Journal of Nutrition found they reduced IL-6 levels by 19% and measurably improved sleep quality, which directly supports the eye's overnight waste clearance system. How to eat it. 4 Oz unsweetened tart cherry juice diluted in 4 Oz water, 30-45 minutes before bed. Add a quarter teaspoon of ground ginger to amplify the anti-inflammatory effect. 3 Bilberries. Rebuilds your night vision molecule faster. RAF pilots in WWII ate bilberry jam before night missions, and military researchers confirmed it worked. Bilberries contain a uniquely dense concentration of anthocyanins that directly accelerate rhodopsin regeneration in rod cells. A 2018 trial in Nutrients found bilberry extract improved rod photoreceptor sensitivity by 22% in 4 weeks. How to eat it. Half a cup of fresh or frozen bilberries in the evening. If unavailable, 160 mg standardized extract with dinner. Do not cook them. Heat destroys up to 60% of the active compounds. Always eat cold or room temperature. 2 Goji berries. The richest source of macular protecting zeaxanthin. Zeaxanthin concentrates at the very center of your macula, acting as a biological sunscreen for your sharpest vision. Goji berries are the single richest dietary source. A 2021 RCT in Nutrients found adults over 65 who ate 28 g of goji berries 5 days a week for 90 days showed measurable increases in macular pigment density and reduced drusen deposits on imaging, something considered extremely difficult through diet alone. How to eat it. 1-2 tablespoons of unsulfured dried goji berries soaked in warm water for 10 minutes before eating. Always pair with a fat source, avocado, macadamia nuts, or olive oil, to increase zeaxanthin absorption by up to 70%. Number 1. Black currants. 60 years of research. Almost nobody eats them. Black currants contain a specific anthocyanin pair, cyanidin-3-rutinoside and delphinidin-3-rutinoside, found together in virtually no other fruit. They don't just support rhodopsin, they inhibit the enzyme that degrades the night vision signaling cascade at the molecular level. A 2012 double-blind study in the Journal of Ocular Pharmacology and Therapeutics found 50 millimoles of blackcurrant anthocyanins daily for 2 years produced 27% less visual field loss in glaucoma patients versus placebo. A 2022 systematic review confirmed they're among the most evidence-supported dietary interventions for retinal blood flow and eye pressure. How to eat it. Half a cup of fresh or frozen black currants in the evening. Blend with your goji berries and unsweetened almond milk if the tartness is too strong. Avoid commercial juice. It's diluted and sweetened to the point of being useless. Pro tip, combine black currants with Tart cherry juice. Together they hit both the oxidative and inflammatory pathways of retinal decline simultaneously. Many patients report noticeably clearer night driving within 3-4 weeks. 6 master rules, 60 seconds. 1. The fat rule. Every carotenoid on this list needs dietary fat to absorb. Without it, up to 90% passes through unused. A teaspoon of olive oil, 5 walnuts, or a quarter avocado is enough. 2. The timing rule. Eat your evening fruits 2 hours before sleep, not right before bed. The repair window opens in the first 3 hours after darkness, and you need these compounds in circulation before that begins. 3. The heat rule. Anthocyanins and resveratrol break down above 140 degrees. Eat everything raw, chilled, or at room temperature. No warm smoothies. 4. The sugar rule. Skip commercial juice, canned fruit, and sweetened dried mixes. The sugar spike suppresses the very anti-inflammatory signaling you're trying to activate, fresh or frozen only. 5. The consistency rule. These compounds don't accumulate permanently. Every study measured outcomes over weeks and months of daily use. Treat this like a prescribed medication because the evidence says it matters just as much. 6. The combination rule. Each fruit targets a different pathway. Rotate through them across the week or combine 2 or 3 in an evening bowl to cover all 6 mechanisms simultaneously. Papaya rebuilds your retinal lining. Red grapes protect your optic nerve. Kiwi supports your eye's drainage pressure. Tart cherries reduce REM inflammation and deepen your sleep. Bilberries rebuild your night vision faster than anything else studied. Goji berries protect your sharpest central vision. Black currants bring 60 years of science to bear on both regeneration and protection, every single night. This isn't about reversing age. It's about giving your eyes what they need during the hours they're already working to repair themselves. Of these 7, which one are you trying first? Leave it in the comments. I read every single one. Hit like if this gave you something real today. Subscribe for evidence-based content like this every day. I'm Dr. Alex Carter. See more, live more. See you in the next one.